This is Suki, a 2.5-year-old female spay pit bull mix weighing around 40 pounds. And today we're going to be performing a physical exam on her. So the first thing I'm going to do is just going to get a general appearance of her. So I'm just looking at her, she's very attentive. She's looking at me. She's curious. Her ears are perked up, She's a good stance. And so the next thing I'm going to do is I'm going to get a gait analysis on her. So I'm going to try to get her to walk around for me a little bit. Come here. So I'm just looking at her gait, making sure it's symmetrical, look for any limping, any deficits or anything like that, and I don't see anything. So next I'm going to go ahead and go towards and get a little more detailed. So we're going to start at her head here. And I'm going to look at her eyes, and they look very clear to me. I don't see any discharge or anything like that. I'm going to go ahead and I'm going to perform a menace response on her. So I'm going to cover one eye, and I'm going to bring my hand towards it and check for that. And then next I'm going to do a palpebral. That looks good. And then I'm going to feel at the top of her head. I'm going to feel for any muscle wasting, I'm going to check for temporalis. I'm going to check for any indentation, and I don't feel anything. Next, I'm going to check both ears. I'm going to feel the pinna, make sure there's no swelling or heat or anything. And then I'm going to look inside of both ears, and I'm looking for any redness, any discharge, or any smell. Next, I'm going to move down to her nose. I'm going to look at her nose. It's wet, and I don't see any discharge coming from it. And then next I'm going to move on to her oral examination. And so for this, I'm going to go ahead and just lift up her lips here in her mouth, and I'm going to swipe on both sides and look at her teeth and her gums. And her teeth do have some tartar, but her mouth is moist, and she does have good salivary production. And then also doing this to open up her mouth, I'm going to do this. And I'm going to check right inside of there, check her tongue, check the back of her mouth. It looks good. And while we're in here, we're just going to perform a capillary refill time, checking for the 1 to 2 seconds. Looks good. Her teeth overall look good, and she has good pink healthy gums. So next I'm going to go ahead and check her submandibular lymph nodes and her salivary glands. And I'm just going to get in the front of her to do this. And I'm going to go right under her mandible, push back, pop those salivary glands out. And then I'm checking for any asymmetrical of her lymph nodes. So if one's bigger than the other or anything like that. And then the next thing I'm going to do is I'm going to check her thyroid gland. So to do this, I'm just going to come feel for her trachea, go on either side, and run my hand down to her thoracic inlet, feeling for any swellings or any asymmetrical lumps or bumps. And then the next thing I'm going to do is I'm going to feel her prescapular lymph nodes. And again, I'm checking for any enlargement of one or the other or any asymmetrical feeling on those. And then next, I'm going to run and feel her legs. Again, checking for any swellings, any heat, pain, any abnormalities I can feel there. And then I'm going to check her axillary lymph nodes, and I don't feel any swelling. Again, we're looking for asymmetrical, any enlargement of one versus the other or both. So I'm going to go ahead and I'm going to just rub my hand along her epiaxials here, again checking for any muscle wasting. And while I'm doing this, I can also run in the opposite direction and then feel and look at her fur, her coat, see if it's shiny, look for any flea dirt, fleas, any abnormalities such as dandruff or alopecia. Now I'm going to check her body condition, and I'm going to feel her ribs. And checking for this, on a scale of 1 to 9, I would give her a 4. You can't see her ribs. You can kind of feel them with minimal fat covering. And next I'm going to listen to her heart and lungs. And so for this, I'm going to check the left side, and we're going to start between the 3rd and the 4th intercostal space, listening to the pulmonic, the aortic, and the mitral valve, and then the right side with the tricuspid. All right, I got about 60 for her heart rate on that. And then next we're going to check her respiratory. And so to do this on both sides symmetrically, how we check is we're going to start at the ventral and then move to middle and dorsal, listening to each spot for a few seconds to making sure you don't hear anything such as wheezes or crackles or anything like that. And then I'll also check her trachea during this time just to see if I can hear airway moving or hear air moving through well under there. Okay. This is a good time to take a respiration rate as well. I'm going to go ahead and do that. Okay, I got about 24 for her respiration rate. So now that we've checked those things, we're going to go ahead and we're going to move on backwards. And as we're moving back here, this would be the best time to take a temperature for her. And then as she allows, if you can check back here while taking a temperature, look at her perineum region. If it's a male, look at testicles. If there's any testicles, look at the vulva, and you're looking for any discharge or swellings for anything like that. So after checking that area, you're going to move down to the back legs, just like you did the front. And we're going to check again for any pain, swelling, heat, or anything like that. The next thing is to check her abdomen. So we're going to do an abdominal palpation. So we're going to go ahead and we're going to start behind the costochondral arch. You're going to have your hands up straight, and you're going to slowly move your hands in until they touch, feeling for any like abnormalities such as swellings, hardness, enlargements. You'll do this a few times, moving from front to back here. As you do, you should feel bowel loops and things like that until you get to the very caudal end where you can feel the bladder. If it is full, you might be able to palpate that as well. Palpating the subingual lymph node back here for any enlargements or asymmetricalness. And lastly, checking the popliteal lymph nodes back here. And that is how you perform a physical exam on a dog.